Good morning, everybody. Thank you so much for joining us today. In case you're not sure who I am, my name is Elise Fry, and I'm the Group Health Manager of our Health Plan Options Department here at URL Insurance Group. So please feel free to reach out to myself or anyone on my team for any group health assistance. A few housekeeping items before we start. There is a chat feature that you can ask questions and we'll reply or answer them out loud. There's also resources with any handouts available as well. And now that I have that out of the way, I'm excited to have Joe Candio, the Vice President of Channel Sales at Vitori Health here. And he's going to help us learn how to quote Vitori for fourth quarter. So without further ado, take it away, Joe.
Thanks, Elise. Good morning, everyone. Thanks for your time this morning. As Elise said, any questions during the presentation, please certainly ask. We try and keep it as informal and laid back as possible. So basically, Vitori Health, what is it? And how can we benefit your employer clients? Vitori Health was started based on the problem in the marketplace of, in insurance where, just your employer groups are constantly getting hammered with large renewal increases, claim denials. Maybe there's balance bill problems because with network access, because they went from maybe a Geisinger health plan or a Capital plan to then United Healthcare. And, it creates a whole slew of problems that falls onto the broker. And as a broker, the challenges are, you're trying to find the best cost plan for your client because they want to save money, but then there's network access issues and the benefit design structure, et cetera, et cetera. So Vitori was built upon those problems as the solution. And so Vitori is an all-inclusive health plan for employer groups with 75 enrolled employees or more. We are a self-funded plan. Our focus is being a high-performance solution. So basically, we do that by combining claims, administration, pharmacy benefits, and member support under one umbrella. So when we say all-inclusive, we're all of those things. We're the TPA, we're the claims repricer, we're the pharmacy service administrator. We come from the private equity space. So we're built from private equity. We have offices in Kansas, Ohio, and we have some offices in Boston. I'm currently in Allentown, Pennsylvania. That's where I'm located. We have sales folks in Texas, Kansas, Ohio, Virginia, in Florida as well. So basically our plan with our model, we're able to save employers anywhere from 25 to 35% on their medical. And basically, the way we do that is we focus on payment controls and the member experience. And so we're able to eliminate the excess costs and conflicts of interest with legacy health plans. So basically, what are we then? So we have the ability to combine our structure and our model with a network solution. So we can pair our model with a physician-only network. Today we use Prime. We also have the ability to do a dual option with Cigna PPO, where we would be the TPA. Our model uses something called fair market payment. So fair market payment is a proprietary algorithm where we take a look at everything from service to geography to the physician providing the care, what that level of service was, what their specialty is, and we reimburse accordingly. Our model reimburses those providers fair, fast, and accurate. Okay. So when we say fair, fast, and accurate, in some instances, our reimbursements may be as good or better than some of their contracted payers. So that model, the fair market payment model, has the ability to be an open access network. However, as I said earlier, you can combine our fair market payment system with a physician-only network or do a dual option with Cigna. And that way that helps sort of ease the client into that open model system. Because as we know today, there are some clients that they're just so comfortable with their legacy carriers, and they're afraid of change. They fear change, and our change, our product is so unique and so modern that we have clients. We have about 60 to 70,000 lives. Our clients are 100% retention right now. So the fact that our system is working and we've been paying claims for 6.5 years, and the fact that we have 100% client retention speaks volumes to what we're doing and how we're doing it. As I said, we have our savings generates between 25 and 35%. As far as our savings off claims, off billed charges, rather, we're doing about 70 to 80% in some instances off billed charges, whereas your legacy carriers are probably anywhere around 50, 55%. We also have on the medical side, we have something called Surgeons of Excellence program. So that program is 450 providers throughout the country. And it's gives access to about 1,500 elective procedures. And basically what that does is if there is any type of elective procedure that doesn't involve bariatric surgery, spinal, or total joint replacement, you have the option of using the Surgeons of Excellence. However, the bariatric, the spinal surgery, and total joint replacement, those you have to go through our Surgeons of Excellence program. And what that does is there's no out-of-pocket cost to the members for going to that. And if for whatever reason a surgeon or a facility in that Surgeons of Excellence program is not in the area, we do cover travel and lodging for those members. And if they want to bring a spouse, a friend, a child, whatever, to accompany them, we cover that. So it's another great program. We also do the credentialing and we do the evaluation. So it's not just we're bringing everybody on board. In some instances, you may have a provider in there that's going to, be able to do hand surgery, but not technically shoulder surgery because they were only approved for the hand surgical piece. So that, like I said, it's a very robust program, and we're not allowing just any provider or facility in, because you may even have one provider in a group, but not the entire group. I'll move on to our pharmacy piece. Our pharmacy piece is basically, we're kind of a combination of physician pharmacy service administration, and we're a combination of that and group purchasing organization. So we're not a PBM, but it's our own proprietary system. So we take a look, we're part of the National Average Drug Acquisition Cost through CMS. And so every day we get a list of dispensed drugs from 67,000 pharmacies across the country. So you've got your large pharmacies, pharmacy chains, and then you have your independents that they have to supply what their lowest cost purchase drug was from the wholesaler. And we apply that to the health plan. So in a lot of instances, we're actually saving money right away to the client. We don't take any money from those savings. Any rebates, it's 100% pass through. We don't take a portion of that. And we also have built-in financial assistance and manufacturer's assistance into our pharmacy piece. So you're already going to get the lowest cost pharmacy drug out there. We make our money on a per script fee. It's about $4, and I think it's $4.03, $4.05, but that's a per script fee. So, again, we're not making money going, okay, well, we're going to give you the rebate, but we're taking a portion of that. So it's not when you quote us, it's not going to be, you're not going to see the rebates. How much is that going to cost with the rebates? That'll be, a separate pass through. So we won't factor that into the quote, but it will be directly passed through to the client. As far as specialty drugs go, if we can't get the lowest cost specialty drug, then we use international outsourcing. So we'll take a look at Canada, UK, and New Zealand for those opportunities. And we make sure that those drugs and where we get them are going through the same protocols as it would through the FDA. Let me see. Back to the medical. As far as our medical plan goes, I know I spoke briefly about how we get reimbursed on the pharmacy side. On the medical side, we also don't get a percentage of shared savings. We get a PEPM rate, and that's built into our administrative fee. Basically, the way we work it with our fair market payment model, we reimburse docs based on, as I said, those factors with geography and specialty and how they've been reimbursed in the past via PPO, cash payments, whatever. And so in some instances, they could be reimbursed at 130, 140% of Medicare or 240% of Medicare. So it's always a moving kind of target, which makes us extremely different than reference-based pricing. Reference-based pricing, you go in, it's set at 130% over Medicare, and that's it. And then your members start to get balanced billed. The great thing about our program, 98% of the time, our members, when they present their card, they receive care. There's no issues. About 0.8% of the time, that provider may contact or have questions, and it gets resolved with our member experience concierge person. 0.24% of the time, members get balance billed. When that occurs, the member is instructed to contact the concierge. Concierge handles that. Member, broker, client are not handling that. And what our goal is to educate the physician on how it works, or their billing person. And if need be, we'll negotiate that away. We reimburse our physicians within 7 to 10 business days. So again, they're getting reimbursed fast, right? Versus BUCAs, it's going to be 30, 60, in some instances, maybe 90 days or longer. And because of that, like I said earlier, we're really getting clients to love this plan, and physicians are loving it because they're getting reimbursed in some instances better than the BUCA carriers. In addition to that, we have the ability to work with our member experience line is designated to each client. So meaning our clients are going to have one contact person, one number on their card. They will constantly get the same person unless that person's on another call, unless they're on vacation or sick, but they're always going to have the same person to walk them through whatever the issue is. Anything from, I need an updated ID card. I updated my address to, I got a balance bill. And as I said before, the balance bill occurs 0.24% of the time. So you have BUCA carriers and reference-based price carriers. It's anywhere from 2 to 15% of the time they receive a balance bill. For Vitori Health, if a member gets balance billed, it's only occurring 0.24% of the time. It is in our contracts as well that we negotiate that away and that the member is not financially responsible. So there's no need for a lawyer letter stating that, to the physician, you have to pay this, or, we're not going to pay you anymore. That's what you're getting. And then the provider winds up suing the patient directly because they want to get their money. We've had 0 instances of any litigation. And so, we stand by that. And that's our approach. Our approach is to have a huge success in the member experience world. And we built that on this platform of basically by other employee benefits consultants who helped start this organization. So that's been our focus. And with our program, our fair market payment program, as I said earlier, we have 25 to 35% savings off the medical. Our NPS score, our net promoter score is above 80. So that's a score that ranges from negative 100 to positive 100. And there are BUCAs who are in the 20s, some are in the negative 20s. We're over 80. So we're very proud about that. And we have members, as I said, our members are never liable for the balance bill. 98% of the employees receive care. And if there's an issue, like I said, our concierge will connect with the provider, connect with the billing person to work that out and handle that. And yeah, we're in every state. We pay claims in all 50 states. We have the ability to write in any state. Like I said, we're looking at 75 enrolled employees or more. It is a self-funded platform. And basically all that's needed to quote with us is we have an intake form. I believe it's on the handouts. And it's going to be same as what you're quoting with other carriers. Company information. How do you want the group to be set up? So what type of deductibles do you want to put in place? What commission would you like? We don't do percentage of commission. We do a PEPM. So, $30 per member per month, per employee per month, or, something more or less. We have the ability to shop the stop loss. We don't have to. And we don't make any money on the stop loss. So if you're interested in shopping stop loss, by all means, you can do that if you have someone that you work with that you prefer. If not, we can certainly do that for you. We also have the ability in the quote process, we can quote those groups that are currently fully insured and aren't self-funded. And the way we would do that, obviously, if you're not going to have data, we can just do a GRX underwriting form, and that we would need a member level census. But basically all your same parameters that you're going to need today. And so my big ask is if you have groups that fall into that range of 75 enrolled employees or more, we would love an opportunity to at least put a proposal together and show you what the savings look like and how much of a benefit Vitori Health can be. We're completely agnostic in the sense that if we have some brokerage firms that work with us and they have their own data support system that they like to feed claims into with other carriers, we can do that. We don't charge for that connection. The only thing we say is, just check with whoever that vendor is because they may charge for a new connection. But we can work with that. We can work with, like I said, any stop loss carrier, any type of consortium, captive. So we're completely agnostic in that sense that we don't have, we're not limited in what we can and cannot do. As far as quoting just medical or quoting just RX, we can do that. Usually it's on special request, but typically we do that with 1,000 enrolled employees or more. Just because that takes away from a lot of stuff that work together hand in hand, and we need a larger population with some data to do that. As far as everything else goes, certainly reach out to me. We can do I can come into the office, bring lunch. We can do a lunch and learn. We can do a separate presentation if you'd like. And I know I have a couple of brokers in the Philly market who reached out to me. They just want to bring me in to talk to one of their clients just about what Vitori is and how that model works. Elise, I don't know if there's anything else we want to add. If anybody has any questions, I'm happy to take them.
Nobody submitted any questions. They're probably just all thinking about all this like wonderful knowledge that you just gave them and how wonderful it is as long as you have a group that fits it, right? Like it works so great. Um, but yeah, there's no questions. So
Yeah. So, again, what I'll leave everybody with is, what is Vitori? And Vitori is a modern health plan platform for self-insured groups of 75 enrolled or more. And we're saving for those groups 25 to 35% on their medical. And it's a great platform to quote. We have the ability to pair it with a physician PPO network or do a dual option with Cigna. And again, that's to kind of offer that security blanket, if you will, of having a network and being able to eventually move to the fair market payment open access model if they so choose. We have some clients that, we just have them with the fair market payment combined with the physician only network, and that works. And they're happy with that. We have some clients that have the dual option, and they're slowly migrating people from the Cigna over to the fair market payment option. And I think the bigger solution is the handholding. I'm sure everybody has horror stories of maybe their own personal insurance, a client issue that they're trying to get help from the carrier, and it's, they get relayed to 10 different locations or departments, 10 different people handling it. Vitori focused on the member experience, and we have that ability to handhold with every client and with every member. And, we make sure that everything works out and there's no issues and there's no disruption. Real quick, before we sign off, I do want to share our homepage. Okay. Elise, you can see this, correct?
I can.
Okay, so this is our VitoriHealth.com homepage. If you haven't had a chance yet, I would strongly encourage you to check out our homepage. At the very top, you're going to see Estimate Your Savings, and that's a link. And if you click on that, it's going to bring you to this page where you can plug in some client information, right? So let's say you have a client, 132 enrolled employees, currently fully insured. It's going to estimate that the current health plan cost is 1.3 million. The health plan cost trend is 7.5. So we'll say that they're with Blue Cross Blue Shield.
It doesn't look like we can see what you're doing.
Oh, no?
No, I still am showing the moving beyond conventional, like the homepage.
All right, let me see if I have to reshare it. How's
There
this?
it is. I found it. I see it.
Sorry about that.
It's all right. I was like, I know you're typing in things, but I can't see it.
So on this page, after you click Estimate Your Savings here at the top, it's going to take you to this landing page, okay? And so here's where I plugged in information. So I said 132 enrolled employees, fully insured. It's going to estimate it's 1.3 billion or 3 million in annual health plan cost. The health plan trend is 7.5%. Blue Cross Blue Shield, we'll say Express Scripts, and we'll say it's a gold level plan, and that they have moderate cost control programs in place. When you click View Results, it's going to give you a nice 3-year projected financial impact report. So this group, if they come with us, it's an estimated claims savings of 1.1 million over 3 years. Okay. You can email this report. It's about a 4-page PDF, and you'll be able to type in your name, your info, maybe the company's info that you're, or a company's name that you're looking to prospect or reach out to about our model. And you can send this to them and say, hey, look, this might be something we just want to take a look at. Or I have brokers today that are using this to get in the door at other companies and have that conversation, because, the BUCA carriers and the traditional way of doing things, just it's not working. And everybody's looking for another solution and another opportunity. And Vitori is that opportunity. Vitori is that solution. So I would give everybody, a heads up to definitely check out our webpage, play around with this savings calculator. It's really cool, and it gives you some company info as well. If anybody has any questions on anything else, I'll stop sharing this page and just there we are.
There's still none.
Okay.
But if I, obviously, as you know, if I get any that come in, I will reach out to you.
Yeah, please download the handouts. Like I said, definitely up for lunch and learns or a happy hour, or if anybody wants to go golfing or bowling or whatever, just reach out to me and we can set something up with your office, your team. If it's just you, that's fine as well. But yeah, I believe I'll send my info through the chat.
Yep.
I'll have everybody's info as well, and I can certainly reach out to everyone.
Well, yeah. Well, thank you, Joe. Thank you for your time. Thank you for this presentation. As you know, I appreciate you and what you do. So yeah, no, if anybody has questions, reach out to either myself or Joe. His information's in the chat. This will be recorded, so you'll all get a recording of it. And I hope everybody has a good rest of their day.
Thanks, Elise.
Thanks. Bye.
Bye.